Great. Well, welcome everybody. We're going to get started. We still have people joining, but we have a lot of content to cover today. So my name is Alice Bonner, and I'm the chair of the Moving Forward Nursing Home Quality Coalition. We have a great featured speaker today, Dr. Joan Weiss, and I'll say a few more words about her in a moment. She's going to be talking for most of the program today, and then we'll have some discussion at the end. We are also joined by our Associate Director, Sumeri Maki, who is managing our technology today, and Sumeri and I will be also watching the chat. And while Joan is speaking, we will try to answer any questions that are in the chat. We also, I already put in my email, but we'll do that again at the end so that you can get in touch with us if there are any questions we've not been able to answer on the call. On behalf of Joan and the HRSA team, we wanted to just make it very clear that the call today, we have a number of different people from around the country who've joined this call. Some of the people don't know very much at all about geriatric workforce enhancement programs. And some of you are very involved, or you're already part of a GWEP, as we say. So we wanted to just be clear that this is not a TA call for GWEP applicants. This is not a technical assistance call for GWEP applicants. So we want to be clear about that. In the slides later on, there are going to be links that you can go to for those technical assistance calls. So Joan can say more about that also. But as I said, Sumeri and I are going to monitor the chat. We'll do our best. We'll make sure you have ways to get in touch with us. We are recording the call today, and we're going to make the call available to people who were not able to join today. So, we just wanted to make that clear. It will be available for other people to join as well. So feel free to keep chatting in your names and organizations if you'd like. And with that, I'm going to go through just a few introductory slides before I hand it over to Dr. Weiss. So next slide, please. So for those of you who are not familiar with Moving Forward, we are a group of organizations that has come together in order to work on improving quality of life for people who live in nursing homes and the quality of work life for people who work in nursing homes, especially direct care teams. And so our vision is that every nursing home will be a community in which lives are nurtured, residents are empowered, and where people want to work. And we're going to do that by taking action now. And we have 9 action plans on our website. Next slide. So all of our work is derived from the National Academies of Sciences, Engineering, and Medicine report that came out in 2022. You probably have seen this report and looked through it. It's full of recommendations. But our work is to make sure that these recommendations do not sit on a shelf by themselves. We are taking action on these recommendations and prioritizing some of them so that we can really get moving now with testing and implementation. Next slide. So this is what it looks like. This is our journey from prioritizing that I just spoke about to creating our action plans. And now we're in this phase 4. We're testing and promoting the action plans that you see on our website. We're revising them. We're out there in local areas, states, counties, et cetera, working with many of you and a lot of your partners. Next slide. So we have an action plan we have these 9 action plans, as I said, and this is an example of one that's about CNA, certified nursing assistant career pathways and registered apprenticeships. And this is an example of, there's a lot of detail in here, talks about how we would test and implement this action plan. And again, all of the action plans have quite a bit of detail in them. If you'd like to take a look, you can go to the website and see any of them that you're particularly interested in. Next slide. So, again, in terms of the CNA career pathways, why is this important? Well, we did a lot of background work, and this is not a slide that is going to surprise anyone on this call, I'm sure, that, there's a lot of issues with retention. And even though recruitment is also important, retaining people who become a CNA or a nurse, social worker, et cetera, all really important. So it is about recruitment, but it's also about retention. So again, this is one of our action plans, but we just wanted to highlight it because this is something that's garnered a lot of attention around the country every single day that we talk to people, and probably the same for a lot of you as well. Next slide. Okay, so with that, I am going to say that, the opportunity today that we're so pleased about is to be able to talk about the geriatric workforce enhancement programs and to really talk about best practices and evaluating the success of these career pathways, which is part of what GWEPs can do and will be doing as they go forward together. So again, I'm very pleased to introduce our wonderful colleague, Dr. Joan Weiss, who's an adult and gerontological nurse practitioner. She serves as Deputy Director in the Division of Medicine and Dentistry at the Health Resources and Services Administration, or HRSA. She oversees workforce development programs in geriatrics, primary care, graduate medical education, mental and behavioral health, preventive medicine, public health, and oral health. So she does it all. And we are just so grateful for her partnership and her ideas. And with that, Dr. Weiss, we are going to turn it over to you.
Thank you, Dr. Bonner. Thank you, Dr. Bonder, and thank you, Ms. Maki, for the opportunity to come today and be part of the Moving Forward Coalition conversation. So this afternoon, I just would, as many of you know, we have a competition, notice funding opportunity announcement for our geriatrics workforce enhancement program, which we call GWEP. And I'm going to talk today about what's different in the GWEP compared to the current one. So what's different in the 2024 GWEP as compared to the current one that was published in 2019. Next slide. So our work is our work is guided by the legislative authority for the program, and this program is authorized by Title VII, Section 753A of the Public Health Service Act, and Title VIII, Section 865 of the Public Health Service Act. Next slide. I'm so used to switching the slide. So we are anticipating, we don't have a budget yet, but we're hoping and expecting about $43 million for this program. We plan to make about 43 awards. So that comes out to be about $1 million per award, and at least $230,000 of the $1 million must be spent on Alzheimer's disease and dementia related training activities. The period of performance is July 1, 2024 through June 30, 2029. So this is a 5-year award. Next slide. So the purpose of the GWEP, of the 2024 GWEP, is to educate and train the healthcare and the supportive care workforces to care for older adults by collaborating with community partners. The applicants must maximize patient and family engagement to address care gaps and improve health outcomes for older adults by integrating geriatrics with primary care and other specialties using the age-friendly health systems framework. So our purpose is to educate and train, and our goal is we want the workforces to be educated and trained. So our goal flows from our purpose. Next slide. So we have 3 overarching program activities, objectives actually. The first is to develop reciprocal partnerships between academia, primary care sites and delivery systems, and community-based organizations to transform clinical training environments into integrated geriatrics and primary care sites and delivery systems that are age-friendly and dementia-friendly. And a really important piece is that you should know, we consider nursing homes to be primary care sites and delivery systems. Nursing homes are places where individuals live. They receive their primary care in the nursing home, as well as their tertiary care. So this is a very, very important concept for us. And we develop these reciprocal partnerships because we want academia to go in and train primary care sites and delivery systems to be age-friendly and dementia-friendly. And we want them to partner with community-based organizations. So prior to the development of the 2015 GWEP, we were hearing that primary care practices would send patients to community-based organizations for a service. The primary care practice never knew if the patient showed up, if they got the service, if they didn't get the service, if they refused the service. So we thought about how can we help minimize that? And we came up with these reciprocal partnerships, and they've been very, very successful. And we've learned a lot from them. Primary care practices and community-based organizations have set up feedback loops whereby when a patient is referred for a service, the community-based organization would get back to the primary care site. We found out that many individuals who are referred to services will accept the service if it is covered under insurance, but may not accept it depending on how much it costs if it's not. So that was a learning experience for us. Our next program objective is to provide interprofessional geriatrics clinical training and education in primary care sites and delivery systems, with a goal to have the trainees, the students, the residents, fellows, to practice in these sites upon completion of their program. And it's very important for us that we address interprofessional geriatrics training. Geriatrics cannot be done by a single discipline. It takes a team. It takes a physician, nurse, social worker, psychologist, rehab specialist, nutrition. So it's very important that we have this interprofessional piece, and to try to get the students to go into these primary care sites upon completion of their education. We are requiring 8-week longitudinal rotations. So some disciplines, like medical students, really have 4-week rotations. So they can do 2 4-week rotations. But this is an immersion in these primary care sites to get the students and graduates to practice there. And this includes the nursing homes. And we'll talk a little bit about that later on. And then the third program objective is to establish and or maintain education training programs in these primary care sites and delivery systems that provide supportive care workforce, direct care workers, and the primary care workforce with the knowledge and skills to improve care of older adults, including persons with dementia, by using innovative technology and methods. So TTOR stands for tribal organizations, underserved and rural. So these sites must be primary care sites. So that's how I know I have that TTOR throughout this presentation. So next, I'm going to define some of the terms that we have throughout the funding opportunity. So if you can go to the next slide. So I know most of you know what an age-friendly health system is, but just to quickly review it, it's a healthcare system to improve the quality of care for older adults and optimize value for health systems by providing older adults with the best care possible. We want to reduce health care related harms to older adults. We want to satisfy older adults with their care. We want to optimize value for individuals, including patients, families, caregivers, direct care workers, the entire educational continuum, including health systems. And the essential elements are what matters to the individual: medication, mentation, and mobility. Healthcare workforce really means like providers, geriatric specialists, primary care providers, direct care workers, people who have hands-on care. And the supportive care workforce are patients, families, caregivers, and non-medical service providers, such as housekeepers, food servers, and transportation providers, and not limited to those individuals, but pretty much everyone else within that system. Next slide. These tribal organizations, underserved and rural primary care sites, there are many of them. We just put a list in our funding opportunity announcement, but nursing homes, nursing facilities, these are high on that list. Next slide. And we did this already. I'm sorry. Can we go to the next slide? Eligible applicants are schools of the health professions, and then accredited graduate programs in health administration and behavioral health and mental health, including clinical psychology, clinical social work, professional counseling, and marriage and family therapy. And next slide. And healthcare facilities are also eligible. Programs leading to certification as certified nursing assistant are eligible. A partnership of school and of nursing and a healthcare facility, or a partnership of a certified CNA program and a healthcare facility are also eligible. Next slide. We will take multiple applications from an institution, but only one application from that institution will be funded. Next. We will be providing traineeship support, and a trainee is defined as someone who is a citizen, a non-citizen national of the United States, an individual lawfully admitted for permanent residence to the United States, or a qualified alien. Next slide. So I'm going to go over the program requirements now. And we went through, I'm not sure why all these number ones came up, but must have done something. So anyway, we've gone through these first three. Next. So this fourth one is really focused on faculty development. And it's really important that faculty and preceptors have the knowledge, skills to educate the workforce on how to provide quality care to older adults and how to be age-friendly and dementia-friendly. Because if they don't have the skills, if they're not aware of the evidence-based practices, then they're not going to be able to do a great job educating their trainees. So faculty development is important and therefore a requirement. Our next one really has to do with the work of our CNA workforce work group within our Moving Forward Coalition. And we have a requirement that applicants use the U.S. Department of Labor or a state agency registered apprenticeship program to provide education and training for direct care workers to support their career development within their discipline as geriatric specialists. So we really want our applicants to address career advancement for CNAs and for community health workers. And using the Department of Labor or a state agency apprenticeship program. You have 5 years to get these in place, so it's not like you have to have it done within the first year, but there are so many, and probably you all have heard that CNAs love what they do. They love being at the bedside. They don't want to go and become an LPN or a registered nurse or advanced practice nurse, or if they're a community health worker, they don't want to become a medical assistant. They just love what they do. And there should be a mechanism for them to advance within their own discipline. And we hope that these career ladders will do this. It will help us with the Moving Forward Coalition. It'll address one of the requirements in the NASM report. This is like a win-win situation. Is it going to be hard work? No doubt. There's no gain without pain. So, but you have time, you will have the money. So I'm hoping that our applicants really, put their heart and soul into this requirement and have it be a great success for not only them, but for the CNAs they'll be training, and also for the nursing homes. This will really help with retention, with recruitment, decreasing turnover. So I'm very, very excited about this requirement. Next slide. Now this is a very busy slide, but our grantees must train at least 3 disciplines within to be interprofessional, and one of those disciplines must be medicine. And this is the list of all the things they have to do. And I'm not going to go through all of them, but some of them are the same. Some of them can relate to nursing home care, but I think that the last one, using the e-care plan, will be really helpful in addressing what matters for older adults within the age-friendly health system framework. Next. So this next one is just keeping in line to make sure that the supportive care workforce is trained to deliver age-friendly and health-friendly care, and for our GWEP grant recipients to develop age-friendly and dementia-friendly programs. The next requirement is kind of related to the work of the Moving Forward Coalitions. It certainly addresses the NASM report on nursing homes. And this is a requirement to have the grant recipients partner with schools of nursing and nursing homes to integrate age-friendly didactic content into the curriculum and provide a corresponding clinical care learning opportunity to student nurses, and this clinical experience should be in nursing homes. And the overall goal for this requirement is to have nurses practice in nursing homes after graduation. So this is another requirement that aligns with our nursing home care and with the Moving Forward Coalition and the NASM report. And then this ninth one, we have evaluation policy and evaluation standards that are required. And then the 10th one is to participate in federally designed evaluations to assess program effectiveness and efficiency. So next slide. So these are all the program requirements. The application due date is February 26th, Eastern time. And here's a link to the funding application if anybody wants to see it. Page limit is 80 pages. We were really happy to get the 80 pages in because we're looking at streamlining things, and some programs have 60 pages, but we were able to justify the 80. So that was great. And the next slide. We had a technical assistance call on December 11th, and it's recorded. It's linked in the second bullet. So just click that on and it should go to that. And next slide. I think that's it. And then if there are GWEP applicants in the audience that have questions, they can send it to GWEP@HRSA.gov. We have a staff, a team answering questions, and should get back to you within 24 hours.
Fabulous. Well, Joan, that was an amazing amount of information. Thank you so much. And again, I know a lot of that information, I hope a lot of that information was helpful to people on the call. I know that there's a couple of questions in the chat that we thought we could ask you about. One of them is from Kathy Neese-Brown, and she asked about whether the program is going to touch on social determinants of health as well as the other things you talked about. She says these issues surround the CNA population and preclude advancement in many ways due to the lack of overcoming the social determinants of health. Can applications address these issues and their impact?
So, Mary, if you can go back a few slides. The answer to your question is yes. Okay, you can stop here. And then I believe we have social determinants of health. Here we go. So all applicants and grant recipients must address health inequities, disparities, social determinants of health, and provide culturally competent, culturally and linguistically competent healthcare. So, yes, and I'm sorry, I just felt that the slide was a bit busy and overwhelming. That's why I didn't list all the topics.
Yes, no, thank you. I think that was great. Also, I should have said at the beginning of our discussion here, if you would like to speak, we cannot necessarily unmute you. So please use the raise your hand icon, and Sumeri and I will look for that and try to call on you and unmute you if we can, or work to make sure that we can hear you. A couple of other people have chatted in, Joan. This is a big picture question.
Okay.
If there's 43 GWEPs or however many there are, multiple GWEPs, people are thinking about, is there some conversation going on about knitting together all of these GWEPs and more of a, I don't know, standardized might not be the right word, but a national approach that would bring together the work of so many GWEPs, so many best practices, but in more of a standardized way so that there weren't lots of different programs that were maybe not connected to one another. And I don't know if you want to talk about either the coordinating center or anything like that, but what would you say about that sort of national approach?
So currently we have 48 GWEPs, and they function as a network. And we have been so thankful and appreciative of the John A. Hartford Foundation and the American Geriatric Society for their work with us. The John A. Hartford Foundation funds our coordinating center, and this is a contract to the American Geriatric Society. So we work closely with the John A. Hartford Foundation, the American Geriatric Society, the HRSA staff, and all of the 48 GWEPs, but not just the GWEPs, but their partners. So the GWEPs are designed to address their community needs. So, you know, the needs in Maryland may be very, very different than the needs in Utah or Wyoming. Now, that being said, we have a lot of work groups. So the coordinating center does a lot of work around educating the GWEPs and their partners on how to become age-friendly. The coordinating center has been really helpful in helping us to train the workforce so that the primary care sites and delivery systems can have a level 1 or level 2 recognition by the Institute of Healthcare Improvement. A level 1 recognition is that the primary care site has already started to work on becoming age-friendly, and the level 2 recognition is they have data that they are working to become age-friendly. So we have approximately 250 primary care sites that have achieved level 1 recognition, and about 150 sites that have achieved level 2 recognition. So there's a lot of collaboration across all of the GWEPs around being age-friendly and dementia-friendly. The Coordinating Center also supports the GWEPs coming together twice a year for an annual meeting. And at that meeting, the GWEPs share their best practices. We have a marketplace, and we rotate, and everybody gets to go from table to table and see what each of them are doing, as well as having topics on age-friendly health system issues, sustainability.
Right. Great.
Things like that. In addition, the GWEPs, many of them partner with each other, like across states or within states. So so there is a lot of collaboration.
Yeah, and a lot of focus on social determinants.
Yes.
So we have a number of questions in the chat, so I will fire away here.
Okay, I'll be quick in my answers. Okay.
That was a great answer. That was a great question and a great answer. Bethany asked, are the only direct care workers who are included in this application the CNAs, or are there other ones? I think you mentioned some other people as well.
So direct care worker is defined in statute for us. And per the Public Health Service Act, it means a home health aide, psychiatric aides, nursing assistants or CNAs, and personal care aides. That's who a direct care worker is.
Great. That's
and a certified nursing assistant program is a program provided by a community college, trade school, or medical facility that provides a 6 to 8 week CNA certificate program that is approved by the state's nursing board. Just because a lot of questions have come up about the length of the program.
Okay, that's great. Super helpful. June asked that, institutions, especially large health systems, could want to submit more than one proposal. So if 2 proposals go in from the same institution, does that mean, that the 2 proposals, that the PIs are kind of competing with one another in a sense, or do you have anything you'd want to add or say about that?
So yes, they would be competing with each other, and we will only fund one. We will not, if both have a fundable score, we will fund the one that scored highest. So I would and of course you have to be within a score that is fundable. We usually run out of money, and are not able to fund everyone. So I would highly encourage anyone who is thinking of having two applications from the same institution to find a way to work together. This should it would strengthen your application also.
All right.
And show that, like, collaboration.
That's great. Somebody asked about the focus of the grant seems to be primary care sites. How would you talk about how hospitals or inpatient units, where a lot of the CNAs also work, on other shifts and so forth, how might they fit into the GWEP program?
So actually, hospitals are eligible, and wait, I have to get down to my definition here. So yeah, here, yes. So hospitals are eligible entities. So I understand what you're saying about the primary care sites. So you will have to identify primary care sites where you're going to provide a lot of your care, but that doesn't mean that you could not train CNAs within a hospital setting, on a wherever in the hospital. It's just that it should not be the focus of your application.
Okay.
So that type of training is certainly supported, just not the focus really is on primary care.
Got it. Very helpful.
You won't be penalized if you do that.
Okay. Okay. Very, very helpful. These are great questions from everybody. Someone wrote in about the challenges with apprenticeships. One of the things is that it requires 2,000 hours of on-the-job training, which is a lot of training for anybody, but particularly a nursing assistant. And at the end of it, if they're still working as a nursing assistant, even though they'll have, badges and certificates, but, it won't necessarily boost their wages, although in some cases it might. But is it at all possible to develop badges that's sort of part of an earn and learn model that don't necessarily require those 2,000 hours of formal registered apprenticeships, in addition to the hours of didactic that are required? So I know we've talked about this, Joan, on our moving forward workforce committee. So it's a question that has come up from other folks as well. So thoughts on that?
So you can certainly provide the CNAs with badges as they go along, but you will have to meet the requirements of the U.S. Department of Labor registered apprenticeship program. And or if your state doesn't have a U.S. Department of Labor apprenticeship program, then state agency apprenticeship program. But yes, you'll have to meet those requirements. But I think it's a great idea to give badges as you go along.
And part of the work that a number of different organizations around the country are doing, part of that work is around adjusting wages or benefits when CNAs go through these programs and do get advanced training. And it can't be that we say to these individuals, oh, you need to go do this training on your own time, spending sometimes their own money. And you're not going to get your wages adjusted. Like, that just doesn't add up. So we have a whole.
And the grant will support the training of the CNAs.
Yes, so that's an important point. But again, the work that I think a lot of us are trying to do is with employers that are going to have to be part of that picture of adjusting wages, as well as working with states that could also think about ways, funding through state agencies or even federal funding to do that. So I think it raises a really good point. Linda Edelman just wanted to make a comment here that there's currently an informal, age-friendly LTSS special interest group among the GWEPs. And that could be a group to help bring the work that the newly funded GWEPs will be doing and coordinate and standardize and share some of the work among the GWEPs, which I think is a really good point to the questions that people asked earlier about doing something on a more national level. Cheryl asked about, are the GWEPs doing anything specifically with physicians working in nursing homes? Just having more of a longer rotation in training, or any focus on sort of mid-career professionals related to careers in nursing homes for physicians and others?
I'm not sure what our grantees are doing regarding physician training in nursing homes. I know we have physicians who head up GWEPs that do a lot of their clinical work in nursing homes. So, but to meet the intent of the funding opportunity announcement, you have to train in interprofessional teams, and the physician discipline has to be one of them. So, might be a challenge in nursing homes, but the GWEPs have been known to meet these challenges.
And I would say, I know that there's a few people from the American Medical Directors Association, AMDA, on the call, and a lot of individual state level affiliates from various organizations are really focused on the crisis that we face with not having people trained who are qualified and want to work in either nursing homes or assisted living or with other older adult populations. So I think it really is a good question. A lot of people are putting a lot of thought into that. So we'll continue to focus on that. Maria asked if you could clarify the distinction between just the terms education and training as they relate to workforce development.
So education means, didactic. You either, take a course online, you take a course in person, but there is didactic content, and training is clinical. You'll have a corresponding clinical experience to reinforce that knowledge, that, book knowledge that you learn, book knowledge, video knowledge.
Ellie asked, can you clarify whether there's a state level apprenticeship program in place, whether those rules are ones that the applicant would follow, or do they need both to follow both the state level and federal level apprenticeship rules? And I guess that's a question of whether those are likely to be different, since the federal office and the state offices work really closely together. So thoughts on that?
So, so about half the states are having USDOL apprenticeship programs, and the other half are state agencies. So you'll need to find out, what your state has, whether it's and you can check with DOL. I'm not sure, or your state agency. We put a resource in for the apprenticeship program in the resource section of the funding opportunity announcement, and I can't remember if they list which states are DOL and which are state agency.
The federal office has been, at least in partnership with us, has been just a good organization to get to share information, and they typically will be able to say if there's a new state agency. We have a map that shows all the states that have their own Office of Apprenticeships and the ones that work with the federal office, but sometimes there's a new office in a state that isn't on that map. So I think it is to follow Joan's suggestions and follow up and look it up for each state.
At DOL, Jamie Bennett or
Lawrence,
Sasha Cooper Morrison.
One question from Sue in Montana. could you just clarify one more time about whether community health workers also qualify for the geriatric specialist certification under the program requirement number 5, or she just couldn't tell if they were included in the definition of a direct care worker? I know you already addressed that, but
No, community health workers are not part of the definition of direct care workers. They're their own discipline, but they are included under the so we have direct care workers, and also we have community health workers who can go through the registered apprenticeship program to get additional training, to get a career ladder in geriatrics.
okay. Sumere, do you want to say more about this question? We got a question. Since apprenticeships are paid as they learn, are their wages eligible costs for the GWEP?
No, just
So.
the training.
All right. Again, these are really good questions, I think, from a lot of the people listening on this call. It's a long, notice for people to go through. So I think these are good questions. Again, one other question sort of related, which is the wages have to be paid through the employment organization, or can they come, does that come through the GWEP budget? I think you might have just addressed that.
So the GWEP will pay for the CNA training.
Mhm.
Any increases in salary will not. Now, that being said, say you have a person who is already like in a career ladder, and they, are have expertise as a dementia specialist CNA, and you have them on your faculty to help with your training, they can be on the grant, but not as part of the career ladder. And we won't pay for the wages associated with the career, the increase in the career ladder. Does that make sense? Just the training.
Talking about earlier that, this is a lot of the work the coalition's done in other organizations around involving employers, because ultimately they're the ones that are paying the wages. So that is an important this. Shelley asked about regarding the 2,000 hours and the requirement for CNAs. Would organizations be able to accept those CNA students even if clinical space is kind of at a premium for people in that program? So, there may be limited spots in that program, but would they have to talk about, being able to, provide those services for those CNAs? And would those CNA students require direct supervision of a licensed nurse as part of the program, the hours?
So I am not familiar with all the ins and outs of the DOL registered apprenticeship program. And all I can tell you at this time is that you need to meet the requirements of DOL or the state agency. That might be a question for you to send to us at GWEP at HRSA.gov.
Okay, it's a good question. I mean, we know some of these programs have waiting lists or just are really full. Some of them are not, but I think it is a good question if you're running one of those programs, because you want to be equitable, but you want to be able to meet the GWEP, what the GWEP is proposing. And Sumere has chatted in again that GWEP resource that Joan just mentioned.
Yeah, that is, if you have questions about the application, or if you have questions about the apprenticeship program, that you should send it there and we'll get back to you.
And Christine wrote in, she's asking a question about a ladder or a lattice as part of the proposal. So is this an opportunity to create through an apprenticeship a program that would involve a CNA geriatric specialist as one of the rungs on a, let's say, a ladder, and then that ladder would continue, and that same CNA would be able to go up in other rungs and become either, become some other specialization.
Yes, exactly. So maybe they start out, becoming having expertise in urinary incontinence, and then maybe dementia, and then maybe a larger, focus on, geriatrics. So yes, or restorative care. Yes. So, it's not just like one and done. It's not just one. It should be a ladder. So with several rungs or steps.
That's great information. And we can also say that there are a few programs around the country, not many, but there are some programs, whether it's an apprenticeship or just a career pathway that's outside of apprenticeship model, that really have those tiers that, that we're talking about, and, multiple tiers, so that people, and some of them are more in a lattice kind of, framework, but, for people to be able to go through and achieve different steps along the way and continue that progression. I mean, it's about professional development for these individuals. And as you said before, there's important programs that we fully support for CNAs who want to go on and become either an LPN or an RN or physician or whatever. And we think those programs are very important. But our focus has been, okay, but let's not lose sight of all the people who love being a CNA and really want to stay in that role, but they want to get more training. They want to learn more. So,
and we want to empower them, and we want to empower them to even become educators within their discipline. So, I think that's why I say this can be like a win-win situation between the CNA, the nursing homes, and academia.
Right. And, and Bethany just chatted in, and all the great direct care workers who are not necessarily CNAs. We don't want to lose sight of that. You've made that point really well, Joan, so many times. It is about that whole team. So, Jane Carmody, I saw you put your hand up, but then you put it back down, but I'm going to call on you anyway, because,
giving you a thumbs up for whatever thing you were saying about the,
well, we always take a thumbs up, but I just wanted to give you an opportunity. Jane,
Hi, Jane.
Joan, so great to be here and to hear this wonderful next step and plan. As you know, we're huge fans of Joan and the GWEPs, and huge fans of Alice and the Moving Forward Coalition. And what a great opportunity to have, a discussion here today. It was just great. Thank you so much. It is just a privilege. In my experience as a previous nurse leader, I'm like you, Alice. Some would say to me, we don't want to be anything but a CNA. Don't try to keep making us nurses, And we're able to develop a wonderful program that really they owned and they created. So, Joan, I think we're going to see all kinds of wonderful creative stuff coming from your encouragement, and what a great opportunity of funding. So thank you, Alice.
Well, thank you, Jane. Thank you for the support of the John A. Hartford Foundation. We would not be where we are without your support, and also with IHI. And so thank you, Alice, and Leslie Pelton and the IHI team, and also to AGS with Nancy Lundenberg and Mariana and Jen Cross.
Yeah, we've got
our team too, our HRSA team.
Yes, of course. Well, we absolutely. But I think for those of you on the phone who've worked with Joan for many years, as I have, her bio was so long, there was no way I could read all of the accolades, but that she's been leading this work for a long time. And this is a huge step forward. To have this explicitly in the notice is a big deal for all of us. And so I want to say a personal thank you just for, HRSA championing this, and for Joan really leading us all on this. And for all of you on this call, whether you're a nursing home resident, whether you're a nurse, social worker, physician, family member, GWEP, QIO, we have representation from so many organizations. This is a tremendous turnout on this call today. We had 250 people registered for this call. We had to close the registration. But
Alice, I just want to say one other thing. We talked a lot about the registered apprenticeship program, but please don't lose sight of educating and training the residents in the nursing home, and also their families. The families, even though their family member is in a nursing home, many of them still play an important role in their care. So, this GWEP allows that training for across the educational continuum, starting with patients, families, and caregivers who are at the center of our model, patient-centered, family-centered, and then branch out to include all members of the health care team, whether you have direct hands-on or you're supportive.
Right. So, and I just do want to recognize Shanice has been chatting in. Shanice is a CNA, and she's, just so glad to hear all of this focus on herself and her colleagues and their careers. And wanted to just really recognize and thank all of the people who are applying to become a GWEP or applying to continue being a GWEP. We are all in this together, and we are aligned around our mission and vision, and we are making progress every day. Some days it feels harder than others, but we are making progress. So we have 2 minutes left, and I'm going to turn it over to Sumire to first ask her if she has anything to add to this discussion, because she's been listening intently and managing all the technology at the same time.
Thank you, Sumire.
Close us out. So over to you, Sumire.
I have nothing more to add. I just want to thank you again, Joan, for this conversation. I know there were some questions I don't think we were able to get to, but we've shared that email with everyone, HRSA, GWEP@HRSA.gov. I believe you can reach out to that email with any more questions, and we'll send the recording and any other materials after this meeting.
Thank you so much. Thank you for the invite.
Well,
really appreciate it.
Well, persevere and be out there, and just many thanks to everybody who joined today. We appreciate everything that you do. So thanks all. Have a great rest of your week.
Bye-bye.
Take care. Bye-bye.